Have you ever wondered why a doctor may recommend a cesarean section even when a mother plans to have her baby through vaginal delivery? Now, it is important to know that having a C-section does not mean that you are failed as a mother or maybe you are less of a mom, because some women have that kind of mentality. In many situations, it is recommended because it's considered one of the safest methods to deliver a baby. Now, I know that there are women that might decide to have elective C-section, that they don't, without any complication, they just want to have C-section. That one aside, but what if your doctor recommend it for you? Now in this video, I'm going to be explaining 6 reasons why your doctor might recommend a cesarean section for you and your baby. So if you're coming across my channel for the first time, you're welcome. Do well to subscribe and hit the like button so that anytime I post a new video, you'll be the first to see it. My name is Uchechi Chizendo, a clinical physiologist. So do well to subscribe. Now let's dive in. And number one reason is if your baby is breech or maybe is lying sideways, your doctor might recommend a C-section for you. Normally, as the pregnancy approaches delivery, the baby settles in a head down position, but some babies remain breech, meaning that the baby's bottom of feet is positioned downward. Instead of the head positioning downwards, their feet or bottom is positioning downward. Another position that can make vaginal delivery unsafe is transverse lie, when the baby is lying sideways across the uterus. If your baby remains breech at later weeks of pregnancy, your healthcare workers may come together and discuss an external cephalic version, commonly known as ECV. Now, this is a procedure where a healthcare trained professionals attempt to turn the head of the baby to position it downward by applying pressure on the abdomen. Now, in this situation, if the baby cannot be turned, a planned C-section may be recommended. That is why C-section, cesarean section is not all about flexing. It's about saving the mother's life and also saving the baby's life. And number two reason why your doctor might recommend a cesarean section for you is placenta previa, or your placenta blocking the cervix. Now listen, your placenta is the organ that supplies your baby with oxygen, nutrients during pregnancy. Sometimes the placenta implants very low on the uterus or covers your cervix. So why is this a problem? Now you need to understand that your cervix is where your baby will pass through during vaginal delivery. If the placenta is covering that opening, attempting vaginal delivery can cause severe bleeding, which can be dangerous for both the mother and the baby. Now, it is important to note that a placenta that is described as low-lying at early stage of pregnancy does not automatically mean that you will need a C-section. But if it happens during delivery, during later stage of pregnancy, particularly during delivery, then a cesarean section might be recommended for you. Now, the next reason is your baby showing signs of not getting enough oxygen. Sometimes this decision happens during labor. Your baby heart rate is monitored during labor, and certain abnormal pattern might indicate that your baby is not coping well with labor. For instance, if there is significant or persistent changes in fetal heartbeat, it may suggest that the baby is not receiving enough oxygen. Now, medical teams will first assess the situation and try to improve the baby's condition. But if the baby condition does not improve, continued labor might be considered unsafe. So in such kind of situation, a C-section may be recommended to save the life of the baby and also the mother. This is one reason you may hear the word fetal distress, because during delivery, that labor period, it can stress that baby. And if the baby is not receiving oxygen, that's a problem. They may recommend C-section for you. So you see, C-section is not all about luxury, as some people might see it. It's about saving life. Now, the next reason is if labor is not progressing. During normal labor, the cervix gradually dilates and the baby moves downwards through the birth canal. But sometimes during delivery, the cervix stops dilating. In such kind of situation, the healthcare professionals will check how much the cervix has dilated, how long you have been in labor, the strength and pattern of contraction. They will also check your baby's position, whether your baby's head is descending. If they check all these things and they see that labor is not progressing, continuing vaginal delivery becomes unsafe. In such kind of situation, C-section might be recommended. Now, let's be clear on something. Being in labor for several hours does not automatically mean that you need a C-section. This decision, it depends on individual situation. Yes, if they check you, maybe your baby's health is not descending, or maybe it's not positioned properly, you're not dilating, then they might recommend C-section for you. And number 5 is bleeding, pregnancy complication that can cause heavy bleeding. Heavy vaginal bleeding during pregnancy or labor can sometimes require an urgent delivery. Now, one example of this is placenta abruption, where the placenta starts to separate from the walls of the uterus before the baby is born. Now, if the pregnancy is far gone and the situation is serious, your doctor might recommend a C-section. Now, lastly, the mother's medical condition or even infection can make a doctor to recommend C-section. Sometimes the reason for C-section might come from the mother's health. For instance, in pregnancy complications, severe pregnancy complications such as preeclampsia, where the mother have a high blood pressure, the high blood pressure is very, very high. In such kind of situation, a C-section may be recommended because you're talking about emergency here. And again, if the mother have certain kind of infection that can influence or harm the baby, for instance, if there is a episode of genital herpes, now doctor might recommend C-section just to reduce the baby's exposure during vaginal delivery. Similarly, certain situations involving HIV can actually influence the recommended mode of delivery depending on factors such as treatment and viral load of the mother. This is the reason why it's very, very important not to compare your pregnancy directly with someone else, because you don't really understand the situation of that person, the condition of that person. Two pregnant women might have the same diagnosis but receive different recommendation. This is because their circumstances might be different. If you are the type that normally compares pregnant women with another person, or maybe you compare yourself with Mr. A or Mr. B, please stop it, because you don't really understand the situation of the person, what the person is going through, the person chemistry, body chemistry. So it's not good to compare yourself with another person, particularly in pregnancy. Having a C-section is not a bad thing. In fact, I want to emphasize on this because there are many misconceptions surrounding this C-section. There are people that see it as a crime in their family or in their lineage that nobody have ever had C-section before. Please, if maybe you happen to meet such kind of family as a lady, run away, because you're talking about life and death here. Pregnancy comes with a lot. You cannot be too careful. Sometimes you might plan to have a vaginal delivery and something might just happen within just the 9 minutes of delivery, and doctors might decide to make such kind of decision just to save your life and save the baby's life. So C-section is not necessarily a bad thing. Now, if you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.